of Imperial College London, who models the course of the virus, and Professor Adam Finn at Bristol University, who looks at the impact of vaccines and is a member of the Joint Committee on Vaccination and Immunisation. Morning to you both.
Morning, Nick.
Morning.
Professor Ferguson, when we say guided by the data, what for you are the key numbers that you keep your eye on particularly carefully? And are they yet giving you a clear picture?
I think there's two important factors. One is how quickly are infection levels declining, and in particular, how quickly are hospitalizations and deaths declining. And the secondly is the emerging picture around the real-world effectiveness of the vaccines as they're being rolled out. And both are looking promising at the moment. So the trade-off we have is between how quickly can we relax and how quickly we can immunize and protect the population. And there's still risks at the moment in relaxing too quickly when we don't have enough immunity in the population, bearing in mind that no vaccine is a panacea and no vaccine will offer perfect protection.
But are you seeing data about how effective vaccines are about cutting transmissions that you can put in your model and try to balance out against the rise in infections there's bound to be once we all start going about our normal lives?
Exactly right. We've got quite a lot of data now from Israel for the Pfizer vaccine, and there's increasing data building up from the UK, being collected by Public Health England and others on what both Pfizer and the AstraZeneca vaccine are doing. It's still early days, though. I mean, it's only been 2-3 months since we started vaccinating, and it takes quite a long time to collect the data needed to really get a good handle on how effective the vaccination is proving to be.
Is the figure of 2/3 we see on the front page of the Telegraph right for the Public Health England view of the impact of just a single jab of a vaccine?
I'm not going to get into the details. Numbers haven't been publicly released, and so I won't speculate on it, but it's not too far off, let's say.
Professor Adam Finn, you're looking at the impact of vaccines, not just on transmission, but on hospitalisation. What's the data currently telling you?
Well, again, like Neil, I can't give you the numbers, but I can tell you that everything's moving in the right direction. And that we've now got to a point with the study we're doing in Bristol where we can say with certainty that there is definitely an effect. It's just hard to put an exact number on it at this point because, again, as Neil said, the numbers of cases coming through are still building up. The number of people who've been vaccinated are still going up. But it's becoming clearer for the Pfizer vaccine, which we've been using for a month longer, since early December. And it'll take slightly longer for us to get a firm handle on just how well the AstraZeneca vaccine is preventing hospitalizations too, but they're definitely doing the job.
So is it inevitable that there's a degree of trial and error here, that governments around the UK have to open up a little, they have to check, they have to look at the numbers, they have to see what happens, open up a bit more if they feel they can, Professor Finn?
Well, I really hope that is the approach that's taken because, while we have got clear evidence on the direct impact of the vaccines in preventing the people who are receiving them from getting sick, what's much less definite is how much impact they're having on overall transmission within the population. And in fact, the age group that we've immunized so far, the elderly, are probably not the primary spreaders, if you like. They're people who are already taking quite a lot of precautions to protect themselves and not mixing that much within the population. And it's the younger age groups who still are or still have to, essentially, in order to work and so on. So I really hope, and it sounds the rhetoric coming from government is that they're going to do this cautiously and avoid having another wave.
Professor Ferguson, some will hear the caution that both of you are expressing. They may celebrate it, but there'll be others who are saying, look, it isn't the same as previous lockdowns because of the vaccine. It just isn't comparable with what we saw last year, and the desperate need of getting people out of isolation for their mental health and for the economic health of the country means that we should be willing to take bigger risks sooner.
I think the downside of taking bigger risks is you risk having to lock down again, which is even more disruptive economically and socially. So, I mean, I completely agree with Professor Finn that I'm encouraged by the cautious approach being taken and the incremental approach, which I think will be adopted, namely relax one thing and see what the impact is, relax again. And it still may well be that by the end of May, we're in a very different country than we are today. But
a country back to normal, in inverted commas, or a country that is still socially distancing, still wearing masks, still has certain rules, but is a lot easier to live in than it is now?
I think more the latter than the former. I mean, we will still have rules in place, but we may well, I think society will be a lot more normal. That is, if things pan out as we hope they will and as the current data suggests they will. There are threats out there. We don't know, for instance, quite how effective the vaccines, how long immunity will last. There's the threat of variants. So we have to be driven by the data and the trends we see.
What about the goal, if I could end with this with both of you, Professor Finn? Some say, look, you've got to try to be New Zealand. You've got to try to eliminate this disease. We heard from the First Minister of Wales earlier on the programme saying it's impossible. An island of our size with this much international travel will never do that. And others go further than that and say, just live with the disease like we do with flu and get on with our lives.
Well, I think living with the disease does involve quite a lot of effort and active. You can't just sort of live with it and let it rip. So I think we are going to continue to have to do quite a lot of things. And I would say that actually I've learned a lot as a paediatrician about the bonus extras of taking these kind of precautions. I mean, normally we see large numbers of children hospitalised every winter with influenza and RSV bronchiolitis, and we just haven't seen them at all this year. So, you know, there are actually some benefits from taking at least a level of precautions and reducing the amount of infection we spread about.
What do you think about the goal, Professor Ferguson?
I don't think it's practical to eliminate it. There's so much, we'd be isolating ourselves forevermore. We're not going to eliminate globally, so we won't eliminate here. I would like to see this virus become like influenza and managed in similar ways. And I think the one thing this pandemic has generated is a whole new generation of vaccines, which frankly are much more effective than the influenza vaccines we typically use year to year. And so I think long term we do have very promising prospects for pulling down the burden of disease, the mortality caused by this virus quite dramatically.
One word answer each, if you would. Have you yet looked at booking a holiday? Professor Ferguson first.
Alas, no.
Professor Finn?
Well, I permanently have flights booked and then I just cancel them. So I live in hope.
We all do. Professor Adam Finn of Bristol University, Professor Neil Ferguson of Imperial College London. Thank you.
But while we're still in this country, let's find about the weather here in the UK. Sarah Keith Lucas is on standby. Hi, Sarah.
Hi there, Martha. Well, what a difference from last weekend. Things are going to be really warming up